Okay, good evening. We just exited our executive session. So from the board, I need a motion to leave executive and start public. Can I have a motion for that?
A motion.
Thank you. A second?
Second.
Was that you, Heather? Okay.
Heather, okay.
Okay, thank you. Good evening. Welcome to a meeting of the Board of Education of Somerset Hills. Please be advised that this and all meetings of the board are open to the public and media consistent with the Open Public Meetings Act, and that advance notice required therein has been provided. This is a meeting of the Board of Education of Somerset Hills at which formal action may be taken. The public will have an opportunity to be heard as shown on the agenda. Due to the public health emergency in the state of New Jersey as declared in Executive Order 103, the board will be suspending its normal meeting procedures this evening and conducting a virtual meeting. Directions for accessing the virtual public meeting were posted on the district website. And I know we tried it a different way last month, but we still are under the 25 person cap for indoor gatherings. And we just decided to do it this way again. We're still working through this and it could be different every month. Jenny, time for a roll call?
Okay. Mr. Baker?
Here.
Ms. Cooper?
Here.
Mrs. Frenda?
Here.
Okay. Mr. McDonald?
Here.
Ms. Nathans?
Here.
Mrs. Santoro?
Here.
Mrs. Tober?
Here.
Mrs. Virtue?
Here.
Mrs. Rye?
Here.
And Mrs. Lees?
Here. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Correspondence, Ginny?
We had one email from Mr. Louis Caruso, parent, regarding program concerns.
Okay. We're going to go into the report of the superintendent, Dr. Dempsey.
Good evening, everybody. I'm happy to report that the 2021 school year is officially underway. Yes, the start of in-person instruction was postponed at Bedwell in the middle school due to the unanticipated ransomware attack. Fortunately, forensic analysis has consistently confirmed that personally identifiable information was not exfiltrated by the threat actors. And yes, the start of in-person instruction was postponed at the high school due to multiple positive COVID cases. But for the last week and a half, all three buildings have been open. High school sports started last Thursday, so with crossed fingers, we are optimistic about the future. We look forward to increasing in-person instruction for certain populations next week. And as of Monday, October 12th, virtual Mondays at Bedwell will be replaced by Mondays serving alternating cohorts in person. We are currently working through plans to roll out similar changes at the middle school and high school over the next month. And while we are not yet ready to mix cohorts, the timing of such a move for select groups of students continues to be a focus for our conversations with the district physician, Dr. Agathis. You may recall that as of our last meeting, the district had between 16 and 17% of its students requesting virtual instruction for the first marking period of the year. This number is now up to about 20% overall, with 22% of the students at Bedwell opting for purely virtual instruction, 18 to 19% of the students at the middle school opting for virtual instruction, and 20% at the high school. We're so grateful to all who contributed toward the reopening of school, all of our staff, but most importantly, for our teachers. They have navigated every new hurdle with aplomb and smiles behind their masks. We continue to monitor public health data and directives from the governor, the DOE, and health officials while navigating accommodation and leave requests. I'm so grateful to Lucy Forgione and her team from Bernards Township for being here this evening to talk to the group. For now, we're cautiously optimistic about the road forward. I understand that there are many of us who want more and many who want it now. Please trust that we are trying to balance everything that we are offering all of our students. We are committed to slowly and carefully expanding our offerings without compromising our commitment to the safety of all students and staff. We have a number of different items under the report of the superintendent this evening. We're going to start with our student representatives reports. I know I preempted them with my report. Colleen has a brief conversation about the graduation pathways, and then we have our team from Bernards Township here. So my understanding of my middle schoolers, where are you? Victoria DeVito and Andrew Trop, are you here? Oh, I see Andrew.
I am here.
Hi. All right. So you guys are going to take it away, and then Lucy Taylor, I see you here too. You're going to take it away after they're through, okay? All right. Go for it, guys.
I believe I'm going first, and it says you cannot start your video because the host has disabled it. So if you could just allow me to.
Let's see if that would be, hang on one second, Victoria, thank you. We have our tech guy who's managing this for us. So let's see if he can do that for you. Jason Winch, do you hear me? There she is. Now we can see your beautiful face. Go ahead, Victoria.
Hello, my name is Victoria DeVito, and I am in 6th grade at Bernardsville Middle School. This year has been extremely testing. Not only did we have to adapt, but we had to adapt quickly. I am in cohort C. As you probably know, this means I'm going to school completely virtual. Even though the definition of going to school is different this year, I am very pleased with this new plan of education. I find that I'm easily included into the class and that I'm learning just as well as those in school. Plus, the school provided me with the necessary tools like a Chromebook. Also, this summer I went to the virtual LTC. This was an amazing opportunity. I learned so much about how to be a good leader and how to use this skill to aid my community. I really hope this will always be available to students.
Hello, my name is Andrew Trop. I'm a 7th grader at BMS. I'm in cohort B, which means that I go to school in person on Wednesdays and Fridays. Although we have faced many hardships at school this year, I've noticed that we're doing a very good job. At Drew University. Virtual LTC stands for Leadership Training Conference, which middle schoolers and high school students from all over New Jersey attend. We get to go to this because we are members of the New Jersey Association of Student Councils. I learned a whole lot about leadership and student council at that experience. Although it was very different from years past, it was quite informative, and I hope to use the things I've learned in future meetings just like this. This summer, I was also a member of the BMS Operations Committee, where we planned coming back to school. As always, we are looking forward to the rest of this school year, no matter what it throws at us.
Hi, I am Lucy Taylor. I am in cohort B, which means I go to school Wednesdays and Fridays. I'm a senior and this year's Bernards High School student representative. I'm excited to be able to work with you and speak on behalf of my peers this year. I can't believe we're already almost in the 4th week of school. So far, the school year has gone extremely well, and I am extremely thankful for all of the work that you all have put into helping make this hybrid school year possible. To start off, in-person school has been going great. Obviously, it's strange to be back in school into a school environment after like 6+ months of working from home, but many of us are excited to be back and grateful for the opportunity. I've heard many different opinions about the in-person instruction. Some students love it. They love the smaller class sizes with the cohorts, and they feel they have more individual time with their teachers in class. People are also just thankful to get out of their beds. I've talked to some students that said that without going to school, they would not have gotten out of their bed or their room for half of the day. So that's always a plus. On the other hand, I do know a handful of students that have already decided to go purely virtual. Talking to these students, I realized there is nothing specifically wrong with the school day, except for that it is not what they expected and it's kind of unfamiliar, which it is for all of us. For most students I know that started off the school year hybrid and went virtual, it wasn't that they felt unsafe in the school environment, it's simply just the unconventional school day. Really just, it's different. The home instruction has become so second nature for all of us. It's the new norm. And it became a lot of these kids' new norm. So for a few other students that went purely virtual, they said they felt the school day was simply lonely. It's hard to get used to not having that social interaction you normally get when you're at lunch or you're just in the hallway getting next to someone's locker and talking to your friends, or even just in the media center. There have also been some questions about simple things such as why are there only a few bathrooms open throughout the school, and can we drink water out of water bottles? That's a big one. Other than these questions, people like the in-person instruction, and again, we could not thank you enough for helping make this happen. Everyone I have talked to thinks that the morning starts, 12:15 dismissal, and after school instruction has been extremely beneficial and works really well. Students are able to meet with their teachers more than ever because they have this time allotted for virtual instruction. Not many students took time out of a regular school day to meet with their teachers for extra help, like not really during lunch or sometimes after school. It was busy because you're going straight to sports. But with this schedule, it's kind of built in and easier than ever to ask your teachers for help, even if it's just with a singular homework problem. I know I have definitely taken advantage of this almost every day of the school year. And finally, it's a big week for school activities. Peer leaders had their first virtual meeting with their freshmen this afternoon, and it went really, really well. All of us were excited to just meet the freshmen, and the freshmen, at least in my group, were not afraid to speak up, and they actually did seem very comfortable, even though it was over a virtual environment. Girls soccer has their first game against Somerville tomorrow, and we are all very excited. We really make sure the girls wear their masks on and off the field, and our bags are set up around the field. So at water breaks, we are socially distanced instead of getting in clusters. All of us really want this season to happen, so we're hoping we can. Boys soccer has their first game tomorrow as well, and from practices next to them for the past week and a half, they've been working really, really hard to play this season too, and they're excited. Football has their first game away at Hillside on Saturday, and that's all I've heard them talk about for the past few weeks. Field hockey has their first away game against Franklin tomorrow, and I know they have been working hard for this season as well. This week is for our school community because we are getting back into it. Overall, people are excited to get back into a fairly normal school year, and with sports, athletics, and after school activities, they were missed, and we really want to make it work, and we know we need to work with you to make this work. I'm excited for this year, and with the next few weeks with school, with school kicking off over us. I'm sorry. Once again, I want to thank you all for helping make this school year happen. And yeah, that's all I have for today. Thank you.
Thank you so much, Victoria and Andrew and Lucy. It's so good to have you all here, and certainly the board and the administrative team love to see you and hear about how your years are going, and never more so than this year, because we know that it's just a brave new world we're all navigating. So thank you so much. You do not have to stay here all evening. You won't hurt our feelings if you leave, but you're certainly welcome to stay. So completely up to you. Mrs. Butler, are you ready?
I am ready. New Jersey regulations require districts to report graduation results annually to their district's Board of Education at a public meeting no later than September 30th. So September 30th this year. There are some specific data points that we're required to report. The total number of students graduating in 2020 was 197. We are also required to give information about the way our students met their graduation assessment requirement. That requirement must be met in both English language arts and mathematics. There are a few different ways that students can meet that requirement, and I'll just kind of go through them. If you have any questions, don't hesitate to ask. 183 of those 197 students met their ELA requirement, passing a substitute competency test, such as the PSAT, SAT, or ACT. 178 of the 197 passed through a substitute competency test as well. We had a few students who used the portfolio appeals process, and that was 2 students met the requirement that way in ELA and 6 students in math. We had 9 students who met their requirement through alternate requirements through their IEPs, 9 in ELA and 10 in mathematics. And we had 3 students who in ELA met it through the New Jersey Student Learning Assessment, and 3 students who met their requirement through the New Jersey Student Learning Assessment in mathematics. The other thing that we're required to speak about are the number of 12th grade students who were denied graduation because of a failure to meet the graduation assessment requirements, and none of our students were denied graduation because of that. We did have 2 students who have additional requirements that they've yet to meet. They're working on those now, but none of our students had to be denied graduation because of an assessment. So that's our general graduation report.
Thank you, Mrs. Butler. I'm going to ask you to introduce the team from Bernards Township, because I know that as much as I have reached out to them numerous times, they have a special place in your heart.
They do, and if I could just give a few shout outs, I'll try to be really fast. But one shout out goes to one of our Board of Education members who has seen this presentation in another venue, and that's Kathy Tober. So I want to thank you for that, helping us to bring this group here together. I want to be able to also give some praise to the Board of Health, the Bernards Township Board of Health, as well as the Somerset County Board of Health. They are doing such amazing work each and every day, and they were, when we called them on Labor Day weekend on a Sunday evening, they responded and started working with us right then. They worked with us all through Labor Day weekend. Memorial Day and Labor Day is kind of just like one, I don't remember there being anything in between that. Also, Dr. Agathis, who I think is here this evening as well. She was with us that entire weekend, and without those teams, I don't know what we would have done. The other big shout out that I have to give is for all of our nurses in the district, and most especially to Ann Connor, who really helped us so tremendously. If Ann hadn't been checking her email on Sunday of Labor Day weekend, we might have had a very different circumstance. And I just, I can't give her and everyone else on those teams enough praise. I'm So grateful to have been working shoulder to shoulder with them. So sorry for the long introduction, but I think we have 3 people here tonight. And if I mispronounce any names, you could just yell at me because I'm on a first name basis, so I don't know all of the last names as well. But we have Lucy Forgione, we have Caitlin, is it Cartoccio? Caitlin?
Yes, it is.
Okay. And Cheryl Conlon?
Yes.
Okay. Thank you so much. So you can do your presentation. If you just say next, Jason Winch will be able to turn the page for you, okay? And again, thank you for all of the incredibly hard work that you're doing each and every day. I know actually how hard you're working, having seen it
We
personally.
appreciate it. Thank you. So I'm going to turn off my camera because we're all in one room. So I think our masks will make it really difficult for us to express ourselves. So I'm going to turn that off and start with our first slide. So this evening, we're going to be talking about navigating the road back at school. And this is a presentation for the Somerset Hills School District Board of Education. It is our pleasure to work with all of you. And how wonderful to have Victoria and Andrew and Lucy speak. That really truly warmed my heart because it makes all of our work so much more meaningful to know that we are bringing our children back to school. And you know, we have all never been through something like this. We went through H1N1, but this COVID pandemic is something that we have never gone through. It's elusive. It's a type of virus that changes, and it makes developing school plans and being more flexible very difficult. So we're happy to be here to present to you. Next slide. So these are the individuals are here. I just wanted you to know that the Bernards Township Health Department is a contractual health agency, and we service 3 municipalities in Somerset County, which are Bernards Township, Bernardsville Borough, Peapack, and Gladstone Borough. And then in Morris County, we service Chester Borough, Long Hill Township, and Mendham Borough. These contractual arrangements also give us different boards of health. Like for instance, Bernardsville Borough has their own board of health, and we work very closely with them and the administration there. We do our best every single day. I think that we've learned a lot. We try to share a lot with everybody around us. We've been at this since January 23rd of 2020. We went from working on travel advisories to the lack of PPE to so many illnesses and deaths in long-term care facilities that kept me up at night. And I still are traumatized over what happened to those long-term care facilities. And we've gone through, you know, lack of masks and things of that nature. And now we are here working with the schools, and everything else around us still continues. So the health department's responsible for inspection of restaurants and pools and spas and all kinds of different public health instances while we're doing all of this. Next slide. So what we pulled together for you this evening, and I want to thank Cheryl Comline, who really did the PowerPoint presentation, and it wasn't an easy task to pull together what we have for you tonight, but it came from many different resources. And the resources are listed here, such as the Centers for Disease Control, the New Jersey Department of Education, the American Association for School Nurses, the New Jersey Department of Health, the New Jersey Department of Health Communicable Disease Services, their epidemiologists that were on the phone with every single day, and then the Somerset County health officers. Each school districts developed their own plan based on the guidelines that you have. We also worked with our superintendents of schools every single Monday for many, many weeks. We worked with those superintendents to review plans. And also just so that you know, we have 45 schools that we manage in terms of preschools to high schools that are under our jurisdiction. So you can imagine how many questions we have and how well we've gotten to really figure this out as we go. We're still not where we need to be, but we don't profess to have all the answers, but we always say that we'll get you the answer that you need. Next slide. So here is some guidance that I think one on the left, the interim guidance for school opening during the COVID-19 pandemic for local health officials, is something that was pulled together by myself and my colleagues, along with my staff, and it's an excellent document and reference. And we use this tool along with the tool to the right, which is the New Jersey Department of Health COVID-19 Public Health Recommendations for local health departments for K through 12 schools. And this was all about communicable disease services with our nurses training. And we asked our school nurses, and really even with the Board of Education here and all of you, to become familiar with some of these documents, because it is chock full of information that has allowed us to open the schools in a way that it meets the plans that you have prepared and allows us to give guidance to all of you. Oftentimes nurses call, sometimes they write us, but we always pride ourselves in getting the information back to you as quickly as possible. Next slide. So our goal for school opening is to facilitate the opening of schools while maintaining the health and well-being of our students, their staff, families, and community. And so far, so good. We've had some situations haven't been so great, but we're really, really grateful that we were able to take on the challenges and either closing and opening them within a certain amount of time and back to the training that we need. Now turn the next slide over to, next training to Cheryl.
Next slide, please. So the basics of infection control start with cleaning and disinfecting. Everybody knows this. And this is what's most important and includes the following: washing your hands using soap and water for 20 seconds often. And the reason for the soap and water is that soap inactivates the virus. Or using hand sanitizer that has greater than 60% alcohol. Having hand hygiene supplies readily available throughout your school. Wearing face coverings or masks that have at least 2 layers and they fit tightly around the nose and the chin. That's the important part. We don't want the virus to escape in droplets. Washing masks after you use them, or using a new surgical mask if that's the type that you use. Use a new surgical mask each day. Cleaning and disinfecting high-touch surfaces. And we know, especially in elementary school, there's a lot of touching going on. So those surfaces are important to clean every day. Limiting the use of shared objects such as art supplies or tech materials, limiting them, especially if they cannot be cleaned easily. I'm sure you've already removed a lot of soft things out of your classrooms that cannot be cleaned. And lastly, covering coughs and sneezes as you would, and properly disposing of tissues so that the disease can't spread. Next slide, please. The first barrier you can use to decrease the spread of droplets that may contain COVID-19 is to wear a mask or face covering every day. However, masks do not replace social distancing, and social distancing does not replace a mask. Both of them have to be used as tools in the fight against COVID-19. The mask, as I said, should be a 2-ply tightly woven fabric. A 3-ply is actually better and is recommended, but 2-ply is okay. You need to replace it or wash it if it becomes wet or dirty, and use a new surgical mask each day if that's the kind that you're using. And because they can become wet or dirty, staff and students should have a spare mask available at all times. The clear face shield that sort of rests on the forehead and then just hangs down in front of the face cannot be used to replace a mask or face covering. It can be used in addition to, but not to replace the mask. But however, there are masks available with clear centers that are tight around the nose and tight under the chin that can be used for those who are teaching children who are deaf or hard of hearing, or are lip readers, or have some disability of non-English speakers, to make it easier to read lips and to guess the words. And this is mostly for school nurses, but if they're wearing an N95 mask, the N95 mask must be fit tested to be sure that it fits on their particular face well and protects them. Next slide, please. So what kind of mask should I wear? There's a lot of discussion, and mostly I see the teenagers wearing bandanas. This is a picture of a study that was done over the summer, and who knew that we'd be testing masks for just general use in the entire population. But it looked at different kinds of masks and the transmission rates of droplets through the masks. You can see on the right-hand side of that chart that there are some masks that allow many more droplets through their material. So although the research is limited, it does give us some perspective on the fact that there are good masks and not so good masks. Gaiters are not included in what would be recommended, mainly because there's not consistency in what they can cover, and sometimes the material of a gaiter is a single ply, sometimes you can make it a 2-ply, but it's not consistent. And then the 3 masks on the right-hand side of that chart are bandanas, knitted masks, and fleece, and they just allow too much potential for spread. Next slide, please. So this year we got used to a new vocabulary word, social distancing. And it allows us to separate individuals so that if one individual is projecting droplets that are infectious, there's enough of a distance that the other individual won't catch the disease. So when you look at schools, it's really to control contact between individuals, keeping students in small groups or cohorts, don't mix cohorts during activities, seat the students and staff 6 feet apart, opening windows or doors for good ventilation whenever it's possible, modifying spaces so students all face in the same direction so that they're breathing all in the same direction and droplets are going all in the same direction, or separating by physical barriers such as plexiglass walls around each desk, which some schools are doing, keeping the flow of traffic in hallways all going in one direction, and staggering class schedules as you've already done as much as possible. Now just note that in preschool, some of the guidelines are a little bit different. So this is these are the guidelines that go from kindergarten through 12th grade. For instance, in preschool, the cohort needs to stay at 10 students, and each cohort has to stay 10 feet away from every other cohort. So it's a little bit different. There are more specific guidelines for preschool. Next slide, please. Every guidance document that's been put out tells us to constantly remind people about wearing a mask and what the symptoms are of COVID-19. And if you try to drill through the CDC website, it's kind of like a maze. You can spend hours looking for good documents, good posters. So we did give all of the school nurses and administrators a list of some links. Once you get into the place on the CDC website where the links are, you can find others, but we gave them some links for posters for how to wash your hands, how to wear a mask properly, and what the symptoms are of COVID-19. Next slide, please. So we need to prevent the spread of COVID-19 from someone who is positive with the disease, and that person may be symptomatic or asymptomatic, to someone who does not have the disease. In schools, this starts with daily screening. It can happen before the student or staff member leaves home in the morning or at the school entrance. And each district has designed a different screening plan depending upon their facility, their staff, what their population is like. But it includes taking the temperature, whether in school or at home before the student leaves, going through the symptoms of COVID and making sure that that student who leaves for school doesn't have any of the symptoms, and then questioning parents, guardians, students, and staff about whether they've traveled anywhere that is has a high risk of COVID infection, or whether they have been exposed to somebody who has COVID-19. And this actually in the New Jersey Department of Health, Public Health Guidance for Local Health Departments, K through 12, on page 17, there is a questionnaire. I'm sure that you guys have already developed one in your school district, but there is one there that if anybody needs to make reference to it. Next slide, please. Okay, to help schools keep track of who is sick and who has what symptoms and when their exposure date was and when their symptoms started, we gave school nurses some screening tools, and one is an attendance line list. A line list is a public health instrument that is often used in long-term healthcare facilities to keep track of symptoms and fever and all of the information that may be needed to track an infectious disease. This also includes the name of the student, but also the name of who called in, just so that it's easier for the school nurses or the attendance person to keep track of it. And then the questionnaire on the right-hand side is the questionnaire I mentioned previously. Next slide, please. So once the school day has started, illness may develop. Students or staff may start to have symptoms after school has started. And this means that every school has to have some place to isolate that individual with symptoms. Isolation space is something that's separate from the school nurse's office, preferably a different classroom, a small office, a large closet, or a corner of a classroom that can be have a barrier put in front of it, or in the school nurse's office in a private exam room, somewhere where it's private, where a ill individual can sit and wait with their mask on and wait to go home, wait to be picked up, whether it's the student or the staff member, so that they can leave the building. School nurses will, or the individual that is with that student sort of supervising them, should use transmission-based precautions. And this is a common term that I'm sure nurses will be, or doctors will be familiar with. It depends on what the potential is for a transmission, but certainly wearing a mask, gloves, possibly a gown, possibly a shield or goggles, while the person who is supervising the sick person is with them, just so they don't become infected. Once the sick person goes home, it's ideal to wait 24 hours before cleaning the isolation space. However, that's not always practical, so the space can be cleaned immediately as long as the person cleaning uses full PPE and prevents themselves from infection. Next slide, please. So what are the symptoms of COVID-19? In the school guidance in New Jersey Department of Health, it lists the symptoms in two categories. This is not black and white. Every kid will have some kind of a respiratory infection throughout sometime during the school year, or have a tummy ache, or feel achy, or have a headache. So it's kind of subjective, even though it is objective. So if a student develops symptoms during the school day, if they have two of the symptoms on the left-hand column, well, of course, with fever, you would always be sent home. But if they have a fever plus one of the other symptoms, they would be sent home. And if they have just, say, some muscle aches or a headache, they could stay in school as long as it didn't progress. The symptoms on the right-hand side are symptoms that if they develop any of those symptoms throughout the school day, the person should go home and be excluded from school until the exclusion time period is over, which Kate will talk about in a few minutes. Next slide, please. Okay, so when should you stay home? Of course, stay home when you're sick, or you've tested positive for COVID-19, or if you've had close contact with someone with the disease within the past 14 days. And this is where the interviewing comes in, the contact tracing, and even the questionnaires on a daily basis. This helps identify people that may have been in close contact. Close contact is defined as being within 6 feet of an infected person for greater than 10 minutes. Please note that this is the New Jersey Department of Health definition. CDC says the same thing, except they say 15 minutes. We go by the New Jersey Department of Health. And a parent or staff member should notify the school when someone has been exposed or become symptomatic. Next slide, please. Okay, so remember that there are lots of things that go on in school that aren't exactly school books, and that includes sports and activities. The guidance for sports and activities divides the sports up into high risk, medium risk, and low risk. And you can see the definition of those risks, what the definition is for each of those levels. For instance, high risk involves a sport that has close sustained contact between the participants, such as wrestling or football or group cheering, where they're jumping or doing a pyramid or lifting somebody up, or rugby, and there are others in the guidance. For medium, it involves some close sustained contact between participants, but with protective gear. That kind of a sport would be a medium risk. If there's intermittent close contact, or if there's equipment that cannot be cleaned, those kinds of sports are considered a medium risk. A low risk sport is an individual sport that has no person-to-person contact. And this is things like individual running, swimming, cycling, golf, things like that. Okay, next slide, please. So with sports, it comes down to contact versus non-contact. So even in high contact sports such as football, some of the practices may be of a nature where they don't include contact. So for high risk sports, if it's a no contact practice, it can be held inside. So things like drills. If it's a contact practice or competition, it has to be outside. If it's a medium, same thing. For low risk sports, practices and competitions, like a fencing meet, can be inside. Sorry, I have to take that back. Fencing is a medium risk. So swimming would be inside, obviously. But the other thing to remember about sports is we don't leave everything else behind. Coaches, parents, spectators, and athletes should maintain social distancing, just like the senior student said. I think her name was Lucy. They put their bags around the field. That's great because they're automatically social distancing. They wear masks. They're automatically protecting from one another. They should be screened before practices and games. This should be especially noted with some of the coaches are part-time or adjunct coaches. They may not be in the school all day and have as much interaction with the athletic director. So it's important to make sure they know that they should be screening. Anyone on the sideline should be wearing masks. If an athlete comes off the field and sits on the sideline, they should wear a mask. Cleaning equipment, washing hands, using hand sanitizer, and of course, staying home when you're sick or exposed. And this has become more of an issue as we get more into the fall with sports. Coaches maybe have a relative that's getting tested. Well, if that person's getting tested, that coach should not be at practice. So this is an important thing to know as sports become more often. Next slide, please. Okay, so the front line of the medical field and schools is the school nurses. And we have already done this presentation for the school nurses in Somerset County. And Lucy and Kate are doing another presentation for those nurses again tomorrow, answering a lot of their questions that they came up with since the first presentation. But the main thing for school nurses is that they have to have a lot of PPE available. The supplies need to be available. They should wear full PPE as needed. And if they're wearing an N95 mask, they have to be fit tested for it. The National Association of School Nurses already has a whole guideline of what to do, and we've given these out to the school nurses. They just need your support, which you've been giving. So next slide, Lucy.
So perhaps one of the best tools that the State Health Department has pulled together is this COVID-19 activity level report. It's something that comes out every single Thursday. It's available online for everyone to view and weekly updated. As you see, Somerset County and Central West, which is Morris County that I deal with as well, were both low risk. But if you look above there, you could see that a couple weeks ago, we were moderate risk, depending on the activity of COVID within our community. It's a Cali score. It's risk-based model. If the risk of transmission is community-wide, then the State Health Department will increase that risk level. It's set regionally. It's based on a percent of positivity. And it determines strictness of the quarantine that we would have to institute. Next slide. So this risk level, the purpose is used to provide guidance to schools. It's based on risk level and regions, and when hybrid remote learning should be used, implemented, or can be changed. So which exclusion lists are to be used? There's a New Jersey Department of Health school exclusion list and COVID-19 exclusion list. I'm going to turn it over to Kate to have her explain it to you. Next slide.
So as Lucy mentioned, exclusion lists are used to determine how long a student should remain out for whatever type of ailment they're experiencing. This could be anything from a runny nose to norovirus, all the way up to, of course, coronavirus. The COVID-19 exclusion criteria is used for ill individuals with suspected or known COVID-19. These individuals should stay home until at least 10 days have passed since their symptom onset, and at least 24 hours have passed after the resolution of fever without fever-reducing medications, and there's an improvement in their symptoms. Next slide, please. The New Jersey Department of Health school exclusion list has been used even since before the pandemic. The school exclusion list should be used if a student is symptomatic and has not had exposure to a positive case in 14 days, or if they've gotten an alternate diagnosis from their healthcare provider. How long they are excluded for is again determined by the illness that they have. Next slide, please. As I mentioned previously, how long someone is excluded for is determined by their illness, and the exclusion list is determined by symptoms, test results, and what category we're in for risk. If someone is symptomatic and has a positive test, and we are in the low risk category, they should be excluded for 10 days since their onset of symptoms, and they are fever-free for at least 24 hours without the use of fever-reducing medication, and symptoms have improved. And the same goes for us if we're in a moderate risk category. If the individual is not tested and there's no alternate diagnosis at that time, and we're in the low risk category, the individual will have to be interviewed to determine if there's been exposure to positive COVID-19 case. If there is no exposure in the last 14 days, the school exclusion list can be used. If that person has been exposed to a COVID-19 positive case in the last 14 days, then the COVID-19 exclusion criteria is used. If we're in the moderate risk category, then no matter the exposure, the COVID-19 exclusion criteria should be used. If the individual is symptomatic, has tested negative, and we're in the low risk category, they should be excluded until they have not had a fever for 24 hours without the use of fever-reducing medications, symptoms have improved, or if an alternate diagnosis has been made. Same also goes for moderate risk category. And finally, if the individual has been to their healthcare provider and they've been given an alternate diagnosis, the school exclusion list can be used for both the low and the moderate category. We realize this is a lot. This is takes a little time to remember what follows what, but you know, we have to interview each individual circumstance, and it's not a one-size-fits-all category. Next slide. Now we're going to cover what we do concerning close contacts. If you'll recall from earlier, a close contact is someone who's been within 6 feet of you for greater than 10 minutes. So you can look at this grid look at this grid as if you were the person who was being exposed. So if you're a close contact of a positive case and we're in a low risk category, you should be excluded through 14 days of your last contact with the positive case. You should get tested if symptoms develop after 5 to 7 days, and the same goes for the moderate risk category. Same goes regardless if the person is symptomatic or non-symptomatic. So for household close contact, so a household close contact is somebody living within your household regardless of if they are family or not. So if there's a family of 5, or I should say 4, mom, dad, 2 kids, and then maybe there's a family friend, they're not technically family, but they're living in the same household, and mom tests positive, the mom, dad, or sorry, I should say the dad, the children, and the family friend all are considered household close contacts. If you're exposed to a person in your home who is positive for COVID-19, you are a household close contact. So what happens from there? So there's 2 routes. So if it's a situation where the positive case can isolate completely away from the rest of the family in their own bedroom and their own bathroom, the household contacts could be excluded for 14 days from the day of last contact with that person. However, more often than not, in our cases, people are not able to completely isolate themselves away from their family. So the household close contact should be excluded through 14 days from the day of the last day of the quarantine for the positive person. So the positive case goes through their 10 days of isolating at home, and then the household close contacts must quarantine for an additional 14 days in addition to that, since they've had contact with the positive case that whole time. This information is usually found out when the contact tracers are doing their interview. They'll ask the positive case if they're able to isolate by themselves away from the rest of the family. If the answer is yes, then it's that 14 days from last contact. If no, it's that 24 days that we saw. Next slide, please. So another term that we've heard in addition to social distancing, we've learned a lot of new words, but cluster. So the term cluster has been used pretty often during the pandemic. So what is a pandemic? A pandemic is an illness that spreads past one geographical location to other continents or countries. So in this case, COVID-19 is expected to happen right now. We're in a COVID-19 pandemic. We're expecting cases. A cluster refers to a number of cases grouped in a place and time that are suspected to be greater than the number expected. An example of a cluster could be a couple cases we had a few weeks ago in the Bernardsville, Peapack, Gladstone area. While we do expect to see cases, we saw a rapid increase very quickly within a small geographical area that may or may not be tied together. To determine a cluster, we have to do an investigation, and that's what we did. And we determined that it was a cluster. Next slide. In addition to a cluster, there's also an outbreak. So an outbreak occurs in one specific location, whereas a cluster could be in multiple spots within a small geographic area. So this is not the sports field and the gym and the grocery store and someone's house. In this case, we're referring to an outbreak as it occurs in a school. So an outbreak is 2 or more lab confirmed cases with onsets within a 14-day period. They are epidemiologically linked, do not share a household, and are not identified as close contacts. So to explain being epidemiologically linked and not being a close contact, because we've gotten that question before, I just like to say, we'll take the case of Sarah. So Sarah is a positive COVID-19 case. She identifies her friend Hannah as a close contact. Hannah then becomes COVID positive and infects her boyfriend. We'll just say his name is Joe. Joe and Sarah do not consider each other close contacts, but they are epidemiologically linked. Next slide.
So your local health department, what do we do? Well, during this time of COVID, what we have been doing and will continue to do is provide advice, communicate. We have these weekly alerts that go out through Bernardsville Borough, through your Friday folder. And we do our very best to make sure that you get the most current information because it is forever changing. And also what we do that's very, very important is to investigate. We investigate illnesses through a system called CompCare and CDRSS that Caitlin will explain a little bit further. And this is ongoing. But we hear from everyone, different schools every single day asking a lot of different scenarios. And what we've done is has designated a contact list. Next slide, please. So a designated contact list is for each school. We have we're a very small department, very mighty but small, and we have different contact people that the nurses and school personnel can reach out to. So this list on the left tells you who to call, what to tell them, contact information and correct information. And one question that we've been getting recently is pertaining to teachers and school personnel. We've been getting inquiries regarding an exposure, let's say a coach who was exposed to a positive football player, and what to do about that. Well, it just so happens that the teacher is not from our catchment area. So I think in that instance, any teacher or school personnel, before coming back to school, they need to reach out or hear from their local health department, because that kind of investigative information is done by that particular health department. Calling me and inquiring, I could only give limited information because I don't have the full story and I did not do the investigation. So it's important to put the responsibility back on that teacher or that school personnel to come back and give you the appropriate information so you could decide whether or not to allow them to come back into school. Next slide.
So the schools know how to contact us. So now the question is when. The school should notify us if they have had a symptomatic student or staff member who has had potential exposure to COVID-19, or if they've had a positive test result of COVID-19 for a student, staff, or household contact. Sometimes we will hear from the school before we actually see the case within our system. The schools will get wind of a positive case by word of mouth, and they should contact us if they do hear that. Sometimes we have investigated and it hasn't been true, it's been a rumor, but sometimes it's better to be safe than sorry, especially in the case of COVID-19. We also ask schools to contact us if they see an increase in the number of persons with compatible symptoms. So earlier, Cheryl was talking about those 2 columns. So if they see any symptoms from either one of those columns, they see an increase of number of persons with compatible symptoms, maybe to the point where they're using the school exclusion list, but they're seeing more kids with GI issues. They're seeing more kids with headaches. They can reach out to us and let us know. They should also contact us if they have a symptomatic student or staff member and we're in a high risk category. Next slide. So contact tracing is another hot button topic that we've been hearing about recently. So how does contact tracing work? So in the, I don't want to say real world, but outside of schools, the person will go get tested, their specimen will be analyzed, and they'll either find out if they're positive or negative. The lab that's doing the testing will then enter that information to a system called ComCare or CDRSS, as Lucy said before. ComCare has been our primary method of doing contact tracing. So once it pops up in ComCare, it'll say that the person's address is 1234 Main Street in Bernardsville. Bernardsville is one of our towns, so we'll be able to see it in our system and we'll be able to do the contact tracing from there. When school was reopening, we got a lot of questions about what will be the role of contact tracing for the schools. So the goal for the schools really is to know where each student or staff member is throughout the school day. I liked before how the students were saying what cohort they were in. So, if we ever had to interview a student in this district, they'll know, which cohort they're with and what teachers they're with and things like that. So we asked the schools to know where the students and staff members are, who they've seen, what classrooms they've been in. Who they've come into contact with, and then all that information is given to us here at the health department or to the person who's doing the contact tracing. Next slide. So what kind of information do we need from the schools? So for the COVID-19 case, it's important to have the contact information and the parent information. Sometimes there's either incorrect information, someone's moved, and we don't have the correct contact information given to us. So the schools will usually have that information so they can pass it on to us. We ask for the date and the type of symptoms this person is experiencing. If they've had a positive test for COVID-19 and when they were last in school, any close contacts in school of COVID-19 cases, the close contacts contact information, and anything else relevant. The school nurses really are the eyes and ears for us in the schools. We're not there every day. We don't see what's happening. So if they think they know of anything else relevant to the case or to the person's story, they're welcome to let us know about that. Next slide. So we mentioned before, there's a form that the school nurses can fill out to send to us. This is the exposed or positive case report form. So sorry if you can't really see it, but on the left-hand side, you can see the form, and it has, like we said, the name and the address, what cohort they're in, who their classroom teacher is, when they were last in the building, any symptoms they've experienced, and then, a spot for contacts and either siblings or household contacts that are also in the district. The school nurse signs it, and then they send it to us, and we keep everything on file. We gather that information, and we take it from there, and we do the contact tracing. Next slide.
So just to give you an example of what Kate was talking about, this morning we came in and had a positive student at another in Morris County, one of the high schools, and it happened to be an athlete. And as a result of getting that immediately, we were able to contact the school, contact the team, contact the other school that they played against, and we got the ball rolling. So this is what the process basically boils down to. We screen at home or at school. We identify positive or symptomatic. We isolate sick person. We wear PPE. We send the sick individual home. We identify close contacts or exposures. We gather information on close contacts exposed, like we did this today and what we did for Bernardsville last week, or a few weeks ago, I should say. Exclude close contacts, have areas cleaned and disinfected, and then send information on sick, exposed, and close contacts to your local health department. So thank you so much for this opportunity. Next slide. You know, this road back for all of us has been really difficult. Information about this new virus is constantly evolving and rapidly changing, and giving you information recommendations change frequently. We do our very best. Often we must be flexible to make sound adjustments on the information that we give you, but we promise you that we will continue to be to do our very best in this difficult and tedious work that keeps ourselves as school staff and community safe and healthy. At any time, we know that schools can go remote or closed depending on the situation at hand. And until we have an effective vaccine that's available against COVID-19, this will continue. So we really have to behave as if everyone we meet and be in contact with is asymptomatic. Our best defense will be to wear our face masks. I think this cartoon speaks to that. To keep social distancing, practice good hand hygiene, and staying home when sick. The Berners Township Health Department, along with the New Jersey State Department of Health and under the guidance of the local boards of health, we will work and continue to be partners with the school, the administrators, nurses, faculty, and staff to provide the proper guidance so that we can make the best decisions possible. We're here to review scenarios and policies that you put in place, and the most important message for you to us is to communicate so that we can educate you best and get our kids to be safe and get the most best education they can, and to empower them to be ambassadors for our school and for each other. So thank you so much. I know this is a bit long, but we're happy that we had the opportunity to share this all with you, and thank you. Be back in.
Lucy and Caitlin and Cheryl, we can't thank you enough for your time and all your hard work. Certainly, Colleen and I have appreciated all of the expertise that you've afforded us over these last few months, along with Dr. Agathis, who we couldn't imagine traveling this road without you. So I think it was important for certainly the Board of Education and the public as well to hear about all the thought that goes into this. And thanks again for coming out this evening. All right, and that concludes the report of the superintendent.
Okay, thank you. I would just love to remark on how nice it was to see those student representatives, and they were so optimistic and adaptable. You know, we're really proud of our kids. They can just adapt so easily, it seems. So that was wonderful to see. Right now we have public questions and comments on actionable agenda items. We very much welcome input from the public. Public comments are welcome at this time on any agenda item. Towards the end of the meeting, there's a second public forum on any topic. Please state your name and address. Comments are limited to 3 minutes, but an individual may speak a second time after all others who wish to speak on the topic have been heard. Please understand that our public forums are not structured as question and answer sessions, but are offered as opportunities to share your thoughts with the board. In instances where the board feels that there is a misunderstanding or inaccuracy, the board president or superintendent may address the comment. In accordance with New Jersey statute, the board will not discuss matters regarding specific personnel. Public questions and comments will be limited to 30 minutes. Thank you for your input. Do we have any public questions or comments on agenda items?
Hi, yes, good evening. This is Kelly Clark. Can you hear me?
Yes.
Hi, Kelly Clark, history teacher at Bernards High School. I wanted to thank the public health officials greatly in presenting that information. That was very, very valid and important. And as an employee of the district, I am very anxious to see how at the high school specifically, how we will be addressing specifically the slide. I'm sorry, I don't know which slide it was, but it dealt with the social distancing and the same direction hallways and perhaps the barriers for the classrooms and I can speak to it personally. The high school doesn't comply with 5 of those 7 bullets. It's a little unnerving, especially with the social distancing. Roughly in a square footage room of about 200. I have cohorts 3 times a day that are 18. The desks are 2.5 feet apart. We're not socially distanced, and so that is concerning. The kids have been great in being respectful and trying to not cluster. I really commend them for that. But you know, that's something that's just a concern, and I hope that we can find ways to kind of manipulate that and do better on some of those, I guess. Thank you.
Thank you, Callie.
Thank you. Any other comments? Okay, if we don't have any other public comments at this time, we can approve the minutes.
Hi.
Oh, we have.
Sorry, it's Kristen DeGrandpre from we're at 7 Flintlock Court. I just want to comment and say thank you for getting us back in school, and thank you for the presentation from the Board of Health. But I did have a comment. Being in healthcare and being with the kids back in school, I did have a slight concern and wanted to ask why there is a difference between us and some of the other towns that are surrounding us in terms of our ability to be back in school. And from what the previous teacher just stated, clearly there's also a difference between the cohorts that are in our grammar schools and our middle schools. It does seem that in our grammar schools, there are very few children that are actually in the classroom in the cohorts. And it would seem like we should be able to be increasing that more to get our children into school more and have more instruction time. I think that would be very beneficial to them. I feel like they are falling behind, and I feel like most specifically it is affecting a lot of kids that are in the special need programs and are on IEPs and things like that, because a lot of their support services are being shifted and they're not able to be met at the same timeframes that they normally would be. So I'd like to see if there's any way we could try and get them back more, especially if we're not having spread.
Thank you, Mr. Grandpre. That is certainly something that we are looking to grow towards with the input of our medical professionals. We are trying to be as careful as we can, but certainly we understand that, you know, in a perfect world, I want every child back in school every day for the length of this school day that they used to be here for. The challenge is how do we move toward that in a way that's not going to compromise our forward progress. And that's really what we're trying to work toward in as deliberate a manner as we can.
Thank you. Another comment?
Yes. Sorry, this is Janice O'Brien. Can you hear me?
Yes.
Okay. I am a teacher at the high school. I also live in town. It was my understanding when we were setting up the schedules that the all virtual day was for deep cleaning the schools. And I'm very excited to have students in my classroom, even if I only do see their eyes. It's very nice to have them there. But I'm just wondering if Bedwell is going back on Mondays and all of the teachers are teaching virtually from their classrooms. Is there a schedule for when the deep cleaning of the school is going on?
Janice, and I'm going to answer this question, but I'm just going to remind everybody that this first public comment session is for actionable agenda items. The day that was purely virtual as part of our reopening plan was never billed as a deep cleaning day. I understand that may have been the case in other districts, and I think that might have been conflated at some point, but certainly that deep cleaning is something that we do every day. We thought it was important to have an opportunity for cohorts to have one day during the week where they could experience their teacher all together and not sort of from this vantage of who was home and who was not. But we do feel as though at this point in time, the year has been launched and we want to move forward, again, as carefully as we can.
Thank you.
Okay, I also see in the chat that Mary Snyder is agreeing with Lucy Taylor on hopefully they can get a water break. So that's something that I know Dr. Nigel talked about in the HSA meeting the other day, and we'll see. We're trying to keep those masks on full time. Any other comments? Comment about the scheduling. Yes, I think you should, if you don't mind. Wait. Okay. We're going to move on now to the approval of the minutes. Can I have a motion to approve the minutes from last month?
I make a motion to approve the minutes.
Thank you, Janice. A second?
Second it.
Was that Nicole?
Yes.
Thanks. Okay. Bob. Oops, roll call. There we go.
Okay. Mr. Baker?
Yes.
Ms. Cooper?
Yes.
Mrs. Frenda?
Yes.
Mr. McDonald?
Yes.
Ms. Nathans?
I need to abstain. I was not in attendance.
Okay. Mrs. Santoro?
Yes.
Mrs. Tober?
Yes.
Ms. Virtue?
Yes.
Mrs. Rye? And Mrs. Lee.
Yes, sorry.
I saw you're not.
And yes, from me.
Okay.
Okay. Bob, can you give us the finance report, please?
Okay, I first want to apologize for not doing minutes written like I normally do, but I've been busy with another project for the last month every day. So I'm going to do it verbally tonight. If anybody has any questions, I can certainly expect it because I cannot write, I cannot talk what I usually write. The first item on the agenda that we had up for our meeting last week on September 23rd, which lasted about an hour, everybody was in attendance, was we have a recommendation from our bond counsel that we should refinance our 2012 bond that we had refinanced once before. It's kind of strange. It's like a home mortgage. You keep refinancing once the rates keep dropping, and that's what they're recommending. So we have a $13 million bond. And without going into a lot of detail, because what we're doing tonight is we're recommending to have a public hearing next meeting in October to talk about this in a lot more detail. But basically, if we refinance either with taxable bonds or non-taxable bonds, we could save $1 million over the next 10 years. So the state law requires us to show a 3% savings in our debt service, which this certainly would be $100,000 a year on this particular bond debt service. So we're going to start the process. We do not have to do this, but we need to have an ordinance passed. So if we decide to do it in December or January, if the rates hold, we can save close to $1 million for the next 10 years. So I would recommend board members to call me or our business administrator to get more information on that. And we will definitely have our bond counsel and other experts available next meeting. It's pretty complicated. This is the first time we've been able to do taxable or non-taxable bonds, which hasn't occurred any time in my lifetime, but the rates are so narrow, there's advantages to do one or the other, the pros and cons. So we're going to explore that. So that's the first thing we talked about. The second thing we talked about, which is also on the agenda, is the RWJ contract for an athletic trainer to be available on a part-time basis for $57,000. That's on the contract. So we talked about the pros and cons of that. The third item we talked about was possibly getting insurance for mold in our buildings. Insurance coverage for mold is available. However, it is expensive. So we're going to explore that with our insurance broker. We may or may not apply for it, but we're going to at least get for what it would cost for us if we did do it. The next thing we talked about was the budget for next year. We just kind of talked about what the budget, some of the key items we're thinking about for the budget next year. And obviously, we all know that everything is going up in cost. All the services and the vendors and the suppliers that we are using, all costs are increasing. So that's become a real issue for the budget for the coming year. So we're going to slowly march through is the process on the budget from now, because the budget we have to get in place and approved by next February. And so we can have a public hearing in March. The final thing we talked about was the coronavirus relief fund grant, which we think we can get $71,000 for use of healthcare for health and safety throughout our buildings. And we have to use it by 2022. So we're applying for that grant. So on the agenda, you'll see there are 15 items for our approval this evening. And item number 15, which is the disposal of obsolete classroom furniture, we talked about in facilities and operations, which I'm going to kind of meld into here because we're going to vote on this. There's some obsolete furniture in room 226, which we find is taking up too much space. So we've agreed in the F&O committee that we could remove that, and it has a total value of 0. So that's an item there. So I'd like to move items 1 through 15. Do I have a second?
Second.
Second.
Thank you, Janet.
Any questions on what I just discussed? Okay. It was that clear, huh? It was that clear. Okay, so we're going to go ahead and do a roll call on items 1 through 15.
Mr. Baker,
Yes.
Ms. Cooper,
Yes.
Mrs. Brenda,
Yes.
Mr. McDonald,
Yes.
Ms. Nathans,
Sarah, you
Miss,
there?
yep, Mrs. Santoro,
Yes.
Mrs. Tober,
Yes.
Ms. Virtue,
Yes.
Mrs. Rye,
Yes.
and Mrs. Lees.
Yes. Okay, so facilities,
Okay. The Facilities and Operation Committee met the previous week, September 18th, for up to 2 hours. First item we talked about was the request for facilities, a rental from outdoor use, which would be our youth football and the parking lot by the Friends of the Library, and people would like to park there for a wedding event. So we discussed that, and the superintendent will go back and discuss that with those various groups. We felt that outside use of our facilities was certainly acceptable at this time as long as they follow our policy. We talked about fundraising events, and again, a lot of these fundraisers are things from the previous years. We're trying to get away from, at the moment, from agreeing to things that we're not sure we can hold much later in the year because they're inside. So we're kind of postponing those fundraisers. And we talked about the disposal of the furniture. We talked about the start of sports this last week and how we were going to do that. The Barker bus contract, we talked about that. That came in as a low bid that we just approved. We only had 2 bids and they were the lowest bid. It's a little bit higher than we thought, but it's still within the range. We also talked about the free lunch program that the governor has done for every student for the rest of the year. So there's a correspondence went out to all parents on the 3 schools, how they could partake in the free lunch service between now and the end of December. Whether that will extend, we just don't know. We also talked about the recovery of our network after the ransomware attack, and everything's back up to normal on that. The last thing I want to talk about, you'll see the only item for F-Note approve is a memorandum of agreement with the Somerset Hills Administration Association, and that is, we've agreed to change their contract for 1 year so they can roll all their vacation days that they did not use over the summer into the coming year. And the reason that we're doing that at their request is they work very hard to get schools up and going all summer long, and most of the administrators did not take their normal vacations. So we're allowing that in this memorandum of agreement. So that's the only item on the agenda. So I would like to move item number 1. Do I have a second?
Second.
Thank you, Sam.
Any questions on my report? Okay, seeing none, we'll go for a roll call on the resolution.
Okay, Mr. Baker,
Yes.
Ms. Cooper,
Yes.
Mrs. Frenda,
Yes.
Mr. McDonald,
Yes.
Nathans,
Yes.
Mrs. Santoro,
Yes.
Mrs. Tover,
Yes.
Ms. Virtue,
Yes.
Mrs. Rye,
Yes.
and Mrs. Lees.
Yes. Ginny, I have a question. Do we have any idea how many students are actually availing themselves of the free lunch?
I don't have a count, but I'll get an update from Greg and send you an email tomorrow.
I'm just curious. Thanks. Okay, Janice, curriculum.
Okay, curriculum committee met last week, and we started out with Colleen Butler giving the committee a summary with a timeline regarding the positive COVID-19 cases in the community. After that, the administration has engaged a middle school French teacher from the Proximity Learning Company who will teach French to our middle school students virtually. We continue to advertise for a full-time French teacher. At the time of our curriculum meeting, Dr. Agathis recommended beginning high school sports after 2 weeks of in-person instruction. However, after reanalyzing the timeline of the community COVID outbreak, she determined the 14-day wait period would be satisfied with a start date of Thursday, 9/24. We also discussed requests from youth sports for field use. After that, we were talking about fundraising or event requests, and the committee determined that we would only consider outdoor events on a case-by-case basis. The Night of Stars for project graduation is currently on hold and may be reconsidered later in the year. The committee also said no to food sales, for instance, candy, and agreed that those seeking to hold fundraising events should share their specific goals and objectives for the events when seeking approval for them. That was about it. I would like to move items 1 and 2 on the agenda. Are there any questions? Okay, do I have, I guess we'll do a roll call.
You need a second?
I'll
You
second,
need a-
Kathy.
Okay, thank you. Okay, Mr. Baker,
Yes.
Ms. Cooper,
Yes.
Mrs. Frenda,
Yes.
Mr. McDonald,
Yes.
Ms. Nathans,
Yes.
Mrs. Santoro,
Yes.
Mrs. Tober,
Yes.
Ms. Virtue,
Yes.
Mrs. Rye,
Yes.
and Mrs. Lees.
Yes. Okay, Heather, personnel, please.
Okay, personnel and policy met on September 22nd and all committee members were there. This evening, we are approving some new staff for a few of our open positions, and we had just gotten an update about that from Dr. Dempsey in committee. And as Janice just mentioned, we are still looking for a French teacher and currently using the proximity learning program until the point that we can find a full-time replacement. Dr. Dempsey continues to get some requests for leaves of absence, and she is working through these on an individual basis. Additionally, Dr. Dempsey let us know that they have had 2 requests for stipend positions per our agreement with SHEA, and she will be reviewing those. We discussed athletic volunteer coaches that some of our teams use, and the committee thinks that at this point, any volunteer coaches should be out of a necessity, just to limit exposure for our coaches and our staff. So she was going to discuss that with our athletic director. And as Bob mentioned in finance, we are going to be utilizing RWJ on a contract basis to have for our athletic trainer until for the next several months. We had advertised for this position, but we were not able to find anybody. At the time of our meeting, the education observation guide had just been released, and administration will be reviewing this and discussing this at their meetings. Mrs. Butler updated us on the need to adjust the calendar slightly for this year based upon the governor's announcement that the state of New Jersey will honor Juneteenth as an official holiday. The observed holiday does fall after our last day of school. However, this is a professional development day for our staff, so we will have to adjust for that half a day, and we will update you as Mrs. Butler works through the calendar. Okay, so that is it for personnel. Ginny, do you have any revisions?
Yes, we have under personnel, number 1, approve appointment for non-tenure.
Can you hear me?
Yes, can you hear me?
Sorry.
Okay, under personnel.
Yes.
Number 1, approve appointment of non-tenure certificated staff, the asterisks. Item B, under salary column, we're going to add the word prorated. And a number 7, approve leave of absence under Family First Coronavirus Response Act. We will remove items E and F and add them under number 6, approve leave of absence under Family Coronavirus Response Act as items B and C. That's it.
Okay. And Ginny, does that include the addendum, the items on the addendum?
Yes, so it would be items number 1 through 16.
Okay. Okay, so I would like to move items number 1 through 16 with the revisions.
I'll second.
Thanks. Any discussions? Okay.
Okay, Mr. Baker,
Yes.
Ms. Cooper,
Yes.
Mrs. Frenda,
Yes.
Mr. McDonald,
Yes.
Ms. Nathans,
Yes.
Mrs. Santoro,
Yes.
Mrs. Tober,
Yes.
Ms. Virtue,
Yes.
Mrs. Rye,
Yes.
and Mrs. Lees.
Yes. Thank you.
Okay, I'll move on. Oh, I'm sorry, Jamie, do you need?
I said policy.
Oh, got it. Okay, moving on to policy. The committee discussed policy and regulation 5111, eligibility of resident, non-resident students, and policy and regulation 5200, attendance. These were in our Strauss Esme alert. We discussed the updates that were mandated by Strauss Esme, and the committee and administration is recommending these for first reading tonight. Additionally, we reviewed policy 7510, the use of school facilities. When we revised this policy in June, we noted that we would need to make sure that the language reflected the true cost of our custodial fees as contained in our contract. So we made changes to this policy to reflect the actual costs. It is important to note, again, as we discussed in the June meeting, that these fees will be charged outside of our regular custodial hours, or I should say when the custodians are not on site for their regular work, and will be passed through to the organization. I would like to move items 1 and 2 on the agenda.
Second.
Thanks. Any discussions? Okay. Do roll call.
Mr. Baker,
Yes.
Ms. Cooper,
Yes.
Mrs. Frenda,
Yes.
Mr. McDonald,
Yes.
Ms. Nathans,
Yes.
Mrs. Santoro,
Yes.
Mrs. Tober,
Yes.
Ms. Virtue,
Yes.
Mrs. Rye,
Yes.
and Mrs. Lees. Mrs. Lees, you're muted.
Yes.
Okay.
Community relations, Kathy?
Thanks, Jamie. The Community Relations Committee met on September 17th for about 2.5 hours. All our members were in attendance, along with our administrators, Dr. Dempsey and Mrs. Butler. We started off with Mrs. Butler providing a really detailed sequence of events surrounding the COVID-19 outbreak in the school community, as well as an update of the current status. You know, I have to say the group really appreciated hearing Mrs. Butler's report and really wanted to thank the entire team directly involved as they worked really, really hard alongside the Board of Health to bring the situation under control. I think it's also worth mentioning that the committee was very appreciative of all the families who cooperated with the district and the local health authorities, which really contributed to bringing the entire situation under control. Next, and as already mentioned and discussed in other committees, this committee had a discussion around the start of sports practices, as well as the request by several groups to hold fundraising events. And as mentioned already, with regards to the fundraising events, this group as well believed that perhaps these should be postponed and we should try to defer them to the spring. So I don't have any items to move at this time, and happy to answer any questions.
Thank you, Kathy. Okay, does the board have any supplementary matters they would like to discuss at this time? Had a lot of presentations tonight.
Yeah, I just would like to say thank you to the Department of Health for coming and giving that presentation. felt like I had a pretty good understanding of it from some of our discussions in committees, but to see all the material was very eye-opening, and I'm definitely appreciative of all the work that the Board of Health, our nurse, the whole, I know I'm going to forget to mention some people, our Dr. Gathis and Mrs. Butler put into this, because, it was a rapidly evolving situation, and the team worked so hard to get the information that we needed to keep our district safe. So thank you, and I appreciate that presentation. It was really eye-opening.
I think I mentioned this last time, and I know I mentioned it at the high school HSA meeting the other day this week, but everybody wants the kids to be back in school for more time, and we are proceeding in an incremental manner so that we don't slide back, because that's the last thing that we want. So the recognition that families really cooperated and were forthcoming with information is very important for us to recognize as well. I agree with you, Heather. And also just that this situation with us being in school it's not a given, it's a fragile thing. We're really grateful that we're in there, and we want to keep it that way, and we want to build on it. So we're relying on all of us, community members, parents, children, to do the right thing, wear masks, not to gather, not to cluster. We want to move forward in this progression. So it's up to all of us to make that a success.
Well, I do want to thank the students that presented tonight, because I think it gave all of us another perspective, because, we're on the other side and planning about how all the school activities and classes are taking place. But I thought it was extremely helpful to get the perspective of the students. So I appreciated that very much.
Any other board comments? Okay, if not, we can move into public questions and comments on non-agenda items. I know we had a comment from Mindy Hemmons in the chat. Do you want to speak, Mindy, or should I?
Hi. Sure, that'd be great. Thank you. So my name's Mindy Hemmons. I live on Old Army Road in town. My husband's actually a teacher at the high school, and I have a first grader at Bedwell. And, I was great to listen in today. I agree. It was great to hear from the students, the teachers, Kelly, Janice. I think as I've observed everything going on the past few weeks, the first thing that I have to say is that, the teachers, especially at Bedwell, that's really what I've seen, have done really amazing things with the kids and, made the most of the situation, and they're doing an amazing job. And I think everyone really appreciates them. I think the other thing I've observed as I've helped my first grader, kind of get through those virtual days, is that it's really hard for the teachers and the kids to have those two different audiences. I think someone I know related to teaching two different classes across the hall at kind of the same time. So, I don't know if it's working a little better with the older kids or a little better at the high school, but with the kids who are young, like kindergarten, first grade, second grade, those, the cohorts and having two audiences to teach to, I don't know if it's the most effective. And I just hope you guys keep an open mind as you're evaluating how do we go into the next phase, how do things change, because it may not be the same solution maybe for each age group. And I think the parents would be open to that, because I know a lot of parents pushed for, hey, I want my kid in school and this and that, but all of our eyes are opening to this. We kind of are learning as we go. And, we really want the best for everyone. And I do fear for the teachers, right, that are doing this, that it's really asking a ton of them with the kids that are much younger, because it is a huge exertion of energy to really keep those kids focused and try our best to kind of engage each one when they're not used to sitting in front of like a tablet, even when they're in school, right? So just asking that we keep an open mind and maybe consider not that the solution might not be one size fits all across all the different age groups.
Absolutely. Thank you, Mindy.
Thank you.
We have a question in the chat from Penny Madaluna.
Hi, Penny Metaluna, 19 Brookside Drive, Gladstone, and I'm also a teacher at Bedwell. I just wanted to let the board know how disappointed I am that the board meetings continue to be all virtual. I've been teaching for 40 years. I've never felt before as unprepared as I have felt this year. And all of my feelings were related to technical issues, and I feel uncomfortable every single day. I just wanted to say that the teaching staff, prior to the opening of school, those teacher days introduced me to a lot of different platforms and a variety of resources, but in no way prepared me for the logistics of everyday teaching in this hybrid situation. It continues to be a daily struggle. And unfortunately, I can't say to the kids, oh, I'm having trouble today, or I don't feel comfortable teaching this way. I know during your board meetings that when you have like a question or an issue, you call your tech guy and he figures it out for you. We don't have that luxury. We have one tech guy for the whole, Bedwell staff, and he's doing a great job, but it's just not enough. So I just wanted to say that I encourage the board to figure this out. I think you should have hybrid meetings like we're having, and I implore you to walk in the shoes of the people that you employ.
Thank you for your comment. I just want to explain to the public that we tried that last month, and we had some auditory issues. And
we have those every day.
I understand that, but our tech people who are actually not, they don't have unlimited bandwidth. We're busy with the ransomware situation, so I couldn't really ask them to focus on this month's board meeting at that time before we were planning this. So we are going to be constantly evolving, and we're all learning and moving forward in an unprecedented way, and we will do the best we can to get our meetings sorted out. But everybody, can only do so much. So that's what's going on with that. We have a comment in the chat, a question from Stephanie D'Angelo.
Good evening. Can you hear me, everyone?
Yes.
Yes. Awesome. Okay. Stephanie D'Angelo, French teacher at BHS now. My question is in regard to middle school sports for the fall, and please forgive me if this was approved in some minutes that I missed, but I'm just wondering if there's an update on middle school sports for the fall, as I am a cross-country coach, and I'm just looking for some feedback with that, please.
We have not approved middle school sports for the fall as of this time. We were struggling just to get the high school sports sorted out. I think we were also looking to see if other middle schools were actually having sports, and many at the time were not. So that is still up in the air, actually.
Okay, thank you.
Question from Nick Hamans.
Hi, Nick Hemans. I live here in town, teacher at the high school, coach lacrosse as well. And I just wanted to bring back up the possible use of using SnapRaise as a fundraiser, since we had 2 board members mention that they're not allowing in-person fundraising. And I believe and I think that it's a fantastic way for us, obviously, to fundraise. It's 100% virtual. There's no contact with the kids. Obviously, we can't go door to door. We can't sell things. We can't have parties. We can't do the things that you would think that most fundraisers entail. But with SnapRaise, we used it 2 years ago, 3 years ago now. It would be 3 years ago. And it's a fantastic platform. Yes, there's a percentage cost that goes along with it, but I find that there's no other way for us to do these things. I'm hoping that in the future, we had multiple organizations of the school use it, and I'm hoping that the board will reconsider their stance on this, because I think that it's a fantastic way for us to do so. We hit people from across the country for making all these various donations that, quite frankly, we would never have any other way possibly to do that. So I hope that the board will reconsider. I'm hoping that we can, as we submit our fundraising plans, that the board will consider this going forward. Thank you.
Thanks for your comment. We have a comment from Sarah Felzerano.
Hi, everyone. I am here as a parent, as a resident, as a teacher, as a coach, as a union secretary, so I wear many hats. For all of those hats, I would like to thank the tireless work from administration, building level principals. I feel like you get left out all the time. We all know how much hard work went into planning the reopening of school, and while it was pretty bumpy, it was bumpy behind the scenes, I feel, but it was smooth on the outside, and kudos to you. Students, kudos to you. This is no way you've ever learned, and no way understand what a classroom looks like, and they are plugging along and doing a great job. Parents, wow. As a parent, I can say this is an adjustment, and parents went through a lot and have been doing amazing. And we've received so many supportive comments and emails from parents, and I'm so grateful for that, as I know much of the staff is, to hear that, the positive reinforcement that we're getting about what we're doing. But teachers and staff, teaching isn't a job, it's a calling, and it's not just a profession, it's a passion. And teachers have had to turn upside down everything they know about their passion and relearn it within a matter of weeks. And kudos to all of our staff and teachers for doing such an amazing job. That was my main point. Secondary, I'm going to comment as a coach. Correct me if I'm wrong, because I was also being mom at the same time listening. I heard something about fundraising and putting it off until the spring. If I'm incorrect on that, somebody please let me know. No.
We talked about indoor fundraising things.
Indoor fundraising. Okay, thank you. That clears it up. But to back up,
and selling food.
Okay, so to back up, Mr. Heemans, that's a lot of what we do as fundraisers. And now that we have our first game tomorrow for most of our sports at the high school, we're wondering too if online fundraising could be approved at this point, and any other kind of fundraising that isn't typically approved, if there could be some flexibility on that. Also, to back up what Penny had said, this discomfort of it's just easier to go virtual for a board meeting. Translate that into the classroom. Yes, we're not students right here at your board meeting, and we don't need to be in person to hear what's said. But it is probably the most difficult month of all of our lives. And to back up what Mrs. Heemans said as well, there is no one size fits all. And as a staff member, I feel like I represent a lot of people saying we implore you to please communicate with us, find out what's working, find out what's not working, find out our technical difficulties, our other difficulties before going ahead and making big decisions.
Thank you for your comment. Jason, do we have people in the waiting room? And if we do...
No, we don't. No one in there.
No, okay. Okay, thank you. I was having a request to let people in, but okay. We have a comment from Judy Martin.
Hi, I'm Judy Martin. I'm a Latin teacher at the middle school and at the high school. It's my 39th year here. I wanted to comment, I had two comments actually. One, tonight you voted upon the retirement of a teacher who's been in the high school for more than 19 years. And I wanted to publicly thank her and wish her well in her retirement. It's Paula Gray. She's done a lot for our school district. And I think that she deserves some public recognition for that. Additionally, I wanted to echo what Penny Mataluna was saying. She's been many years teaching here, and that this last month has been the hardest of my 39 years here. I am technologically savvy. I am one of the teachers who teaches other teachers. I am spending 15 hours a day working. I am working well into the night, because to take a worksheet and make it interactive so that the students on the other end feel that interaction, it takes a couple hours per worksheet. It just doesn't magically happen. And I do want to say that although we were exposed to some wonderful programs and sites, and the districts purchased licenses for us, we weren't really trained in it, or I didn't feel like we were trained in it. I don't feel confident in some of these things. I would love to have more training in things. I was exposed, but exposure is not the same as training. So I still haven't been able to use the things because I'm trying to play catch up. It's the hardest month I've ever taught. And I really want to say thank you to our staff. They're supportive of everybody and they're all helping each other, but it's hard. I need you to know that.
Thank you, Judy. We have a comment from Mr. McCarron.
Own issues. So I'd officially like to, as Shay, head negotiator, like to ask for a copy of the sidebar agreement between the Board of Education and Shaw. So I'd officially like to ask to see a copy. I didn't see it attached at the end of the agenda for today. So if the association could get a copy of the sidebar agreement.
Sure.
Thank you. Is that clear?
Yeah.
Okay, thank you very much.
It's going to be posted.
Oh, it's going to be, yeah, I didn't see it, so that's why.
Well, yeah, I think it was on the.
I looked on the agenda. I didn't see it. Maybe I missed it, but
Yeah.
I didn't see it. So thank you.
Sure. Yeah, it'll be posted after tonight's meeting on the web. Okay, we have a question from Therese. Hi, Therese Taylor.
Hi everyone, it's Therese Taylor here. I'm a parent and also the president of the HSA at the high school. A couple questions and just a comment to add to some of the technology things, a thought for some food for thought. Some of the parents also, as we have collected questions from the parents, interestingly, the technology aspect comes up consistently. So it's not only teachers who are challenged by that aspect, but also parents when their children, lose connections. Those aren't necessarily the board's problems. Some of those, of course, have to do with Comcast. But what it all comes together to is sort of this question of how do we support the online teaching in a better way. We question technical support, and I wonder if there's some opportunity to have some discussions about solutions to that and ways we can address it collectively. Do we ask for volunteers from the community? Do we hire someone extra? But this is apparently a problem, and it is causing a struggle both for parents and for, obviously for the teachers. So that was one thing, and happy to bring up some of the things that we've thought about to try to help out with that, but also curious what the board is thinking about and how you're thinking about solutioning those things. And then the second thing is, in terms of solutions and some of the ideas that have come up, just for those of you who have talked about fundraising and sports, some of the outdoor activities, when can we start having conversations about what would be permitted outdoors? We've talked about purchasing tents and that kind of thing. How can we start having those conversations? And is it possible to have those conversations outside of a formal board meeting? How would we go about that? So that we can potentially start other ways of having a school experience since we can't be inside. Completely appreciate that, but how do we have a conversation with you as the board to see what we can do? How would that work? So two different subjects, but food for thought and just how do we move forward to maybe pursue some solutions around these things in this very, very unusual situation.
Gretchen, do you have any thoughts?
Yeah, thank you, Ms. Taylor. I appreciate your gesture toward supporting the challenges of online teaching. Certainly, I hear all of the challenges that the teachers are talking about. I am sensitive to that. When Judy says that she is technically savvy, she most definitely is. And when a teacher like that says, you know, this is a lot for me to navigate every day, I understand that. Sarah and Jim and Penny, you're talking about veteran experienced teachers, and really the whole world has turned upside down. So I think for us as a district to kind of get in the weeds a little bit on that would make sense. And quite frankly, I hadn't thought about it from a parent perspective. So I appreciate that. From a standpoint of your outdoor activity piece, I think the best contact for those are always the principals of the buildings. They are the closest, and as we've heard from other people, you know, there's not a one size fits all. So I think it makes sense to reach out to your building principal, and as your role in the HSA, I think you've got a great avenue there to help.
Thanks, definitely happy to do that, whatever we can do.
And whatever people come up with, you know, we will be discussing those things in committee as we move forward. Do we have any other comments from people? I appreciate everybody's input and perspectives. I know that probably every single household is having technical struggles here and there, and there's probably one unfortunate soul in each house that gets all the questions. Thank goodness it's not me. But, you know, I mean, my husband's always complaining, IT, and, you know, it's not something most people don't really love doing. So I feel it for all of you, and it's tough. These are challenging times. Again, I'm grateful to every staff member who has contributed to our reopening. The board is grateful, and we have our fingers crossed that we can move forward and we'll all get better at this, and we can get improved help for people. And we appreciate your participation in this meeting tonight. If there are no other comments, I would ask for a quick comment, please, from Wendy. Yes. Wendy.
Hi, Wendy LaBruno. I live and work in the district at the high school. I'm the learning consultant. I just kind of wanted to caution the district about moving forward too quickly with the reopening plan, only because there are several, at least at the high school, there are several classrooms where the students are, as Kelly Clark stated previously, that are not entirely socially distanced while in school. And I do understand that we want to have as many students in the building as possible. I just would like to caution the district in moving forward too quickly, and just to make sure that all the decisions that are being made with the utmost caution and precautions for the safety of everyone in the buildings. Thank you.
Thank you. We are certainly moving with the guidance of health officials, and that is why our superintendent is insisting on moving in this incremental manner. So some people think it's too slow. Some people, I think we're moving at a reasonable pace and a well thought out pace. So thank you for your input. Anyone else here tonight? Okay, if not, can I have a motion to adjourn?
make a motion to adjourn. Janice.
Janice, you beat me to it. You're not allowed to do that.
I'm fast.
I know.
You're seconding?
I'll
Bob?
second it. I'll second it. We're out of here.
All right. Good evening, everybody. Thank you for coming.
Bye-bye.
Bye.
Thank you.